Good morning, everyone. It is Tuesday, February 1st. Welcome into the Morning Medical Update. Thank you so much for joining us here on Facebook and on YouTube. On today's update, it has been a year since one Kansas health worker lost her husband to COVID. Now, Kelly Kidd is sharing her story of those horrific few weeks watching her husband fight to stay alive. We'll also tell you what she is doing to help ease her pain and help others through this difficult time. Plus, how do you get over the grief and fear related to COVID? Therapist Jamie Kopagan from Turning Point is joining us to tell us what we need to do, plus help ease you and your family's fears about the COVID virus. So please make sure you get your questions sent into us on YouTube, Facebook, and on the Medical News Network. You can find links right there on your screen. Let's get to our COVID count this morning. Dr. Dana Hawkinson is joining us now, and I know that our numbers have gone up. Can you help break down those numbers for us?
Yeah, they certainly have gone up a little bit. 109 active infections. I think we were at 100 yesterday. 28 in the ICU, 16 on the ventilator. Still 98 in that recovery period. Total of 207 then. But, you know, I think we really need to look at the 7-day rolling average, and I think we will see variations. We do have a number of people who are discharged every day, but unfortunately we still have a lot of admissions every day. From the MARC data, the regional data, it does seem like our cases around here have peaked and are on the downtrend, so that's a good. Hospitalizations seem to be on the downtrend as well from their data, so I think overall there's good news. I think we will continue to see maybe day-to-day fluctuations, and we really need to look at that rolling 7 or 10-day average.
All right, Dr. Hawkinson, thanks so much. Any reporters on the line with us today? All right, so please
yes.
Please go ahead.
Sorry, Charlie Keegan here from KSHB 41 News. Thanks for having me. We got word today that our sources saying Pfizer could ask the FDA for emergency use authorization for a vaccine for young kids as early as today, setting up for approval maybe by the end of February. What kind of difference would that make in our current situation, in your opinion?
Yeah, I think overall that is going to be helpful for parents' anxieties and about their children who are too young to be vaccinated. Again, we know the vast majority of children, especially younger children, are going to be okay, but we do know that they are still susceptible to severe disease and multi-system inflammatory disorder. This vaccine is going to help reduce those chances of those children getting those severe disease entities and multi-system inflammatory disorder. I think it's going to help a lot, and I think that is one more step to having more of our total population who is going to be protected from the most serious cases of disease. So I think overall it's a good news. It might be, the timeline might be a little bit ahead of where we have heard. Certainly in the last month or two we've heard different projections as to when. But if it could be by the end of February, I think that would be great if we can start using these vaccinations on those young children.
Charlie, any follow-ups?
No, I'm great. Thank you.
All right, thank you so much for your question today. We will get to our community questions here in just a moment, but since the start of the pandemic, more than 7,500 people have lost their lives to COVID-19 in Kansas. Here at the University of Kansas Health System, more than 755 people have died of a COVID-related death since March of 2020. 53 people in the month of January alone. 8 of those happening right inside the emergency room, 13 of those deaths out of Great Bend. One of those people who lost a loved one to this virus is a woman named Kelly Kidd. She works at a nursing home around many folks who are vulnerable to COVID-19. And this morning, she shares her emotional story of seeing just how fast the virus can take away the person you love most in the world.
His laugh and his big bear hugs.
For Kelly Kidd, memories of her husband Rob are still fresh.
We went snow skiing in Colorado. Rob got down on one knee, and I didn't think anything of it. I just thought he was posing for the camera, and that's when he proposed to me.
But this is not how Kelly expected her fairy tale to end.
We were married 8 years. We had our anniversary when he was in the hospital in the COVID unit.
49-year-old Rob Kidd, along with his wife Kelly, was
very much in respiratory distress, because the only thing that he was able to say to me was, "I love you so much. I love you so much."
Kelly was at his side every day. Rob never came off the ventilator.
It was, just telling him how proud I was of him, and that it'll be okay. He lived his life to the fullest every single day, and his body was done.
Rob died January 2nd, 2021. 2 days later, Kelly honored him by getting her vaccine.
To not only protect myself, but to protect my family.
She also wanted to protect the residents of the nursing home where she worked. As a member of healthcare, she didn't hesitate when asked to do more, to share her most painful memory of Rob in a PSA.
And I lost my whole world.
Kelly knows their story might save lives.
I can touch one person. If one person changes their mind about getting vaccinated, I said, yeah, I will. I know that Rob would want me to do that. And Kelly was not able to join us this morning, but as you can tell, she is still recovering more than a year later from her grief. And we've brought in one great expert able to kind of help us explain the pain that Kelly and so many people are facing right now. That is Jamie Kopakin with Turning Point. How are you this morning?
Great, thank you for having me.
Well, good. Lots of questions for you today because we know that grief shows up in so many different ways. And we're going to talk more about that in just a moment. But this specific type of grief, a loss during a pandemic that involves everyone, and we can all relate, but when you see somebody like Kelly, this group of people who have lost someone to COVID, it's different than what we're used to. Tell us how.
Sure, I think her story is so powerful and it's relatable because for many reasons. One, I think we expect things in life to go a certain way, and when they don't, it's really hard to kind of reconcile that, to put that together. So we expect to get married and live happily ever after and die at a ripe old age, and when that doesn't happen, it really throws us, and we expect something and something else happens. So to put that together, we have this thing called cognitive dissonance where it just doesn't fit. And I think we're all kind of experiencing that right now because we expect to go to the grocery store and be fine. We expect to find our toilet paper, right? And things aren't the way that they're supposed to be. So it takes a while to get used to that. And that process of change and getting used to that is grief. We're grieving a loss of what should be or what could have been as well.
And facing a loss during a pandemic. I mean, people are facing all sorts of different obstacles and challenges, but to face the ultimate thing that we all fear having to go through, it's inevitable that we lose a spouse or a parent. And so it's different. A lot of people will feel like if you haven't gone through it, you don't really understand it. So why do people feel so alone during this time? I mean, we've all experienced some type of loss, but these folks feel alone. How can we help?
I think there's a few reasons. One, because our traditions have changed so much, right? If you do lose somebody and you can't have a funeral, so you can't have people gathering and supporting you and being there in person, or if you have fewer people, it's just different, and we need that support. We need connection. That's how we're wired and built. So that's one piece of why it's different. I think there's also, unfortunately, a little bit of blame of how somebody died, how somebody got COVID, and that's rough to kind of work through. And this is new. We sort of expect people to die in certain ways, and this is something that we have to get used to.
You brought up a good point because it's been so politicized and people are on two different sides of things, which is so unfortunate during a health crisis like that. But you're right. It's people having to defend. Normally you would have people wrap their arms around you, and now you feel like, did they get COVID? Were they not being safe? Were they not vaccinated? And we don't know people's stories. Right. And so you're trying to caught between, wanting to, again, embrace people, but then people bring the judgment in.
Yes.
Making it all much more difficult.
Yeah, I think we see this even with other things like depression and suicide. Sometimes people don't want to say why the person died or how the person died, or drug addiction or alcohol abuse. And so, we need to work on getting over that. We want to know why and what happened at the end. But also the point is, if the person is no longer here, if they have died, we need to say those words and help each other heal.
A loss is a loss. I want to talk with you different types of grief because we know that there are folks like Kelly handling this horrible grief during COVID, but I think all of us are probably experiencing some type of grief or loss. And it got me thinking last night, what types of grief are there? And there's grief from loss of financial security, loss of a job, watching a parent diagnosed with Alzheimer's, the loss of a pet. I lost my dog this weekend. And I found myself comparing my loss to somebody else's who may be worse than mine. What do you have to say about that? Where we always say, loss is relative to your situation. How do we keep from comparing and contrasting our loss to someone else's?
So the comparisons can be helpful if they're helpful, right? To say, okay, wait, I need to keep this in perspective. Other people have it worse. But it's not helpful if that makes you feel like you're not entitled to your grief, if you're not entitled to feel what you feel. There's these cliches that are useful. Feelings aren't wrong, feelings just are. And so if we can kind of get back to that and say, okay, if my pet has died, or my father has died, or somebody else that I care about has died, or even if it's not that a death, if it's like you're saying a loss of divorce, or your best friend moved away, or you're switching schools, all these losses can either be a kind of a trauma with a capital T, or even a trauma with a lowercase t, meaning it's a little bit less traumatic, but it still hurts, it's still painful, and it still requires a process.
Well, because we do always say things could always be worse, and that's probably true for most situations, but it's okay to just sit in it and own it and have it.
Yes, and it's necessary. You have to feel that emotion so that you can get through it. The emotions, a lot of people, especially unfortunately men, try not to feel things, but it's information, right? So if I'm feeling scared, I need to know that so that I know what to do about it. And if I just pretend I'm not scared or sad or grieving, I'm missing out on important information to help me get better.
It's something that when I lost my dog this weekend, it made me feel like I got to be really strong, because one day I may lose a parent. And if I can't handle this, how am I going to handle that? And so you get kind of wrapped up in your own head and overthinking instead of just allowing yourself to be sad.
Agreed.
Which brings me to my next question is grief an actual state of being, or how do you know the difference between grief and just feeling sad and bummed out, or maybe a little depressed?
Yeah. And I think we use those terms kind of synonymously. We kind of overlap them a little bit. Some of it's severity. So if somebody has died recently, or you've experienced some sort of a loss, sometimes we're really quick to say, oh, this person's depressed. Well, they're really going through this grief process. And so it's okay to pause in that and not be quick to diagnose. Where the diagnosis is helpful or useful is kind of if it's impacting your life for it's an extreme amount for a long time. And that's kind of a relative term. What is too much sadness? What is too much difficulty? And that's different for each person. So I think it's always helpful, in my opinion, to seek help, to talk to your friends, to talk to your clergy, to talk to a therapist, to go to a support group or grief group. So you're just, again, armed with information and you have an outlet. If you can't get there, the nice thing, one of the silver linings, if there are a few of COVID, is online, right? We can actually see people, and we're more comfortable seeing people online. And then, online chats and blogs and finding that information and connection.
How do you think social media has helped people with grief? Just posting, seeing people reach out in ways that maybe they wouldn't have been able to pick up a phone and call you or come see you. Do you think it's helpful to use social media and Facebook as an outlet?
I think, like everything, there's this balance, right? So let's take the good and try and minimize the bad.
Sure.
So the social media can be a lot of comparison and a lot of, oh, well, I'm not as bad off as this person. I only lost a pet and not a parent, so therefore I shouldn't complain. So let's try not to go there. But where we can go is the idea of, again, connection. And, you can get 400, likes and hugs and care emojis really fast, which feels good. But if we're waiting for that and we're, expecting that, then that does not feel good when it doesn't happen.
That doesn't help us actually work through the grief. It can maybe
Correct.
help instantaneously, but there's more to it.
Correct.
And more work to be done.
And balance, right? So the balance of seeking that and needing that and feeling good about that, but not sort of hanging on it.
Yeah, and hanging on it, relying and waiting for those likes to come through, for sure. It's that word balance. We hear that a lot. So I want to ask you about something, and other things that people are feeling a loss is a loss of their personal freedoms when it comes to COVID. Help us understand a little bit of the mindset of that. Again, we're trying to have grace and understanding of people who feel differently than we do, and we're trying to help our viewers navigate those conversations. But for people who feel like getting a vaccine and so on and so forth, how do we have those conversations with them feeling that type of loss?
Yes. Well, I think it's tough, right? Otherwise, there would be an easy answer if there was an easy answer. But I think people don't like to be told what to do. Even in therapy, I think people come in thinking, oh, the therapist will tell me what to do and how to feel better. And that would be nice. But then the person doesn't own it. Then they feel like it's just another person telling them you need to do X versus I think that the opposite is really trying to understand why that person is reluctant. What do they need to feel more comfortable seeking, whether it's the vaccine or wearing a mask or staying 6 feet away or being in a crowd or not being in a crowd. I think to really try and understand one-on-one how the other person is thinking. And that's sort of our bigger global problem probably, is that we get so entrenched in our own points of view and we don't want to meet in the middle. I remember reading a long time ago that if you're at the extreme, it's really challenging. It almost, destroys you to seek information from the other side. But if you're a little bit more in the center, and you don't have to be perfectly centered, but a little bit more in, then you can want to hear the other person's point of view. You strive to understand the other person's point of view, and you remain curious. And then that is interesting, right? To find other points of view versus feeling like, well, I can't hear that person. It's going to, destroy me somehow.
You made a really good point. You might have the only job where people come to you and they are okay with you giving them the answers and telling them what to do.
And then we don't.
And then you don't. You don't give them what they're wanting, right? So just tell me a little bit about how your work has changed during this time of COVID. Any specific issues that are standing out? Just what's it been like for you?
Sure. Well, a lot of anxiety. I think there's a lot more people that are just in fear and uncertainty. And again, one of the nice, things about COVID is that people are more willing to seek help. They're more willing to get through the stigma because they feel like everybody's been experiencing the same thing. So everybody kind of understands what anxiety is now a little bit better versus saying, well, I'm not that bad off, kind of back to the comparison. I don't really need help. I'm not crazy. I'm not, stuck in bed all day. But you want to seek help before all those things happen. It's easier to solve a problem when things are small. So I guess the way my work has changed is there's more people calling and online too. I've been doing most of my work online recently, and I hope to get back in person. But I think we're getting a little bit more comfortable with that so that you can reach people in rural areas or people that can't drive for medical reasons or they don't have a car or access to transportation. So there's just a lot more barriers removed to seeking help.
Question is just, but we're going to get, I'm going to ask you 4 more questions and we're going to get to some community questions as well. But what's your best piece of advice for someone listening right now? Just that's going through something. I mean, life is messy and heavy and it's all the things. And I think we all want to put on a happy face every day. But what would just be your best advice for all of us handling some type of grief or sadness?
Yeah, I think the main thing is to be curious, to keep trying to, again, understand that other person's point of view. And not thinking you know all the answers and you have everything right, but to be curious and to listen. So I think that would be the main thing is, again, trying to bridge and understand what other people are going through.
Let's get to some community questions. We've got some for Jamie and for Dr. Hawkinson today. But Tanya wants to know, just how do we overcome that feeling of being in this kind of never-ending loop of new variants coming in? So I think you both could probably comment on that. Jamie, I'll have you start, but just the emotional thing of like, we do have people saying, please, Dr. Hawkinson, Dr. Seitz, tell us that we can see an end in sight. We need that hope. How do we handle that?
Yeah, I think that's really tough because, again, we want this certainty, this will be done, on this particular date, and then we can all go back to normal. And we're just sort of bombarded again and again with this sort of unease and uncertainty. And so some of that is then grief, maybe it's really helpful to talk about these 5 stages of grief. There's lots of different stages, lots of different models that explain it, but real briefly, people are in shock, and then there's some sort of sadness or depression, anger, and bargaining, which is, if only this or if I do this, then things will be okay. And then acceptance is the final stage. And it'd be nice if we went in sequential order. We don't. We kind of bounce all around. So we sometimes get to a little bit of acceptance of saying, okay, we've been doing this for a couple of years. This is how it is. And then we get another variant. And then we're all upset again. So sometimes knowing that this is the process that we have to go through can help us kind of fit it into our brain and make sense of it so that we can move through it.
All right, Dr. Hawkinson, just that crystal ball for people. I know that you don't have all the answers when it comes to when it's going to end or what these new variants are going to do, but what advice or what thoughts do you have?
Yeah, I mean, speaking from, pure medicine or science point of view, just understand that new variants will come in. This is just the nature of viruses. We know for rhinovirus, which causes the common cough and cold, we know there are multiple different variants or isolates out there. For influenza, we know that happens every year, and this is why there are 4 different strains in the vaccine. We know that since we've been tracking that, just new influenza variants come up, and so this is just what happens, unfortunately. Just understand that it doesn't mean that the world is ending. Hopefully we are continuing to get better. We are seeing that we are able to get back to some semblance of things before we were in the pandemic. The K was filled this year. Arrowhead was filled this year. We've seen pictures of other indoor arenas and Fog Allen and T-Mobile Center. So you can get to these things, but just be thoughtful in your manner and understand that you are trying to protect yourself and your health, your bubble or your family's health and do those things that can help you do that. And that is get vaccinated in those high situations where there's more risk. Maybe wear a mask, distance, try to do things outdoors. It can be daunting for people because everybody wants this to just be done and be more like 2019. But the fact of the matter is we still have these variants. There are probably going to be other and new variants that come in and displace Omicron. So I think it's just understanding that you can protect yourself and your family and get vaccinated. Hopefully now with the possible vaccinations for those younger children on the horizon, that will help as well. Things that we can do to keep moving forward. But I know it can be daunting. It's just you have to understand that unfortunately this is how we are. It won't always be like this. But for the foreseeable future, we will continue to see new variants or just continue to see cases. But as we get further into this and we have more people who have immunity and protection from going to the hospital, either through vaccination or recurrent infections, that is going to help as well. We won't have these capacity issues in the hospital. We won't have these supply chain issues because people can't go to work. We won't have schools shutting down because teachers will be out. So it will get better. It just is going to take time, and it's not going to be a 1 week to the next switch. But it will take time, but it will be better.
Will be better. I like hearing that. A couple more questions for you, Dr. Hawkinson. Emily wants to know if you personally can speak to when the vaccine will be coming for children per the Pfizer news. Mm-hmm. What will the series look like, and what does the data tell us as of now?
The latest I heard was that those 2 doses didn't work, and that's why they were trying to go back and had to identify maybe a different regimen, maybe 3 doses. It's really not clear what Pfizer is putting forth. Again, they are analyzing the data. They are applying, and so hopefully some of this data will be coming out. A lot of it is either done in preprint or news articles with preprint, or a lot of the information we've gotten from those early vaccine studies with Pfizer and Moderna have been through New England Journal of Medicine. So maybe something will be published in there in the coming days, and we'll have more information then. But everybody has been somewhat reserved in saying when the vaccine will be available, and now this latest news that it might be available at the end of February. Hopefully there will be some data coming out soon showing exactly what to do, how many doses, and things of that nature.
Jamie Isaac wants to know, is grief experienced differently if the death is sudden, like a heart attack or an unexpected car crash, as opposed to just over time, a cancer diagnosis, dementia, Alzheimer's?
Yes, it definitely can be experienced differently. And that's why grief is so individual. But some people would prefer to have some time to get their affairs in order and to say goodbye to loved ones and to sort of prepare for the death coming. It makes it easier for us to get through it. So when it's sudden, we don't have all that. We don't get to say goodbye. We don't get to, revise wills or, those kinds of things, or put affairs, money, or, personal belongings in order. So that just creates a whole lot of chaos kind of when it happens suddenly. Sometimes people say, I'd rather that. I'd rather just have it be, quick and done. I don't want a prolonged illness, or I don't wish that upon anybody. So it's really personal. It gets back to the grief is individual and personal. And also that kind of ties into then how do we connect with people, right? If it's so personal and individual, then we have a tendency to say, well, I don't understand this and I can't help you. Versus, again, the striving to understand, to say, you know what, I'm not exactly like you and my grief is not exactly like yours, but I want to understand and let me know how it can help, and really being present and listening to that individual as well.
So it's okay to say, I don't understand, but I'm here, I'm listening.
Yeah.
So is there a right and a wrong way to grieve?
The short answer would be no, that I think that people just grieve the way they need to, but there are some tools that would help people process more easily, more smoothly. And some of that is, listening to yourself, listening to your own emotions, asking for help. I think the helpers tend to either smother or abandon, right? So getting back to that balance idea of asking the person what they want, can I help you? How can I help you? Not just assuming this is what the person who's grieving must need and I need to do these things, but really asking.
And what about people who rely on substance abuse, alcohol? Mm-hmm. That certainly can be a wrong way to grieve, correct?
Yeah. Yeah, I think it sort of adds an additional problem to the problem. So now you've got the grief and the alcohol issue. So you've got two issues to deal with. And certainly, there's the short-term grieving versus long-term. So it makes sense when somebody has died or something has been disrupted in your life that you may not go to work, you may not be able to get out of bed, you may be crying uncontrollably, you may be feeling nothing, you may be very numb, and therefore turn to substance abuse or throwing yourself into work or doing whatever that activity is that helps you not think. The problem is severity and how long the thing lasts, so sort of this duration. And then the third factor is frequency. So how often is this interrupting your life, and how severely is it interrupting? And then that's kind of when you know to seek help if it's disrupting your life enough.
Angela wants to know, how do we handle or assist and help our children through grief? Did they feel it differently, I would imagine?
Sure, they
They're in a different place?
Yeah, it's a great question too. I think kids need to be talked to at the level that they understand. So I think parents want to protect children and then not talk about grief or whatever the serious issue is, COVID or anything else. I think of all of the political issues that people tend to try not to talk about because it's uncomfortable for children. I think the opposite is the better way to go, to find a way to talk to children at an age-appropriate level. And really the easiest way to that is answer their questions. Ask, do you have questions about grandma dying, or do you have questions about this political issue or some sort of rally or some sort of protest or whatever it is that's going on in the news recently? And then answer their questions and be okay going there. And if the parent is calm enough to go there, the kid usually calms down as well, because the kid can feel like, okay, this is something we're allowed to talk about. There are answers there. We can get through it.
Let's talk about the physical effects. Can there be physical, and could they be possibly long-term physical effects of, a hard hit with grief?
Yes, especially if it's not something that you're working on dealing with. And but when I say that, I don't mean you have to work on it every single moment of every day. But generally, you can't stuff it for very long. So if you stuff it for a long time, things sort of like that teapot that has no escape valve, no steam valve, things blow up. So either you internalize and you get mad at yourself and you sort of can spiral into depression or even anxiety, or you put it outwards and you're a very angry, cranky, kind of irritable person. And that's when people don't know why they're so angry. So some of that is helpful, again, talking to friends and family or therapy to find out what is going on, what's underneath that anger that's making me so upset. So it can come out in those kinds of mood changes. Physically, people get back pains, stomach pains, ulcers, all sorts of physical ailments because they're holding tension and holding things in. And certainly, all the other categories, spiritual, maybe they're losing faith in God, or maybe they're refinding faith in God. Work, financial, it's sort of social, friendship, it sort of spills out in all those areas. So if you can be more self-aware, it's really a plug for being self-aware, then you can say, okay, I see what's happening here and I'm connecting the dots, and now I need to find out what to do about that to help myself and help those around me.
Boy, I'm glad you're here today. I'm taking it all in. Dr. Hawkinson, Misty's asking kind of a back to basics question, but I'm glad she is. How does me getting the vaccine help others?
Well, it for various reasons. Number one, you are getting the vaccine. It will help reduce your chance of going to the hospital. We know that in households, vaccinated households do help decrease the spread of disease to others as well. We know that when you are well and you can work, that helps overall our community and being in work and things like that. We also know that it does help reduce the amount of replication competent or live virus, quicker than unvaccinated people. So you do have less of a chance to spread it. Now, that's a little bit quicker. You go through that stage quicker than those people who are unvaccinated. So those are really the main reasons. But it is, again, for your own health, but also, there is evidence that you do help decrease the spread of the virus as well. Even Omicron, maybe a few days sooner than you were if you were unvaccinated.
Linda wants to know, what's the rule on this? Should I isolate after I think I've been exposed?
If you are vaccinated and boosted, I believe you do not have to quarantine after exposure. You just monitor for symptoms. And that may be true as well. I'd have to go back and look at the quarantine rules from CDC and recommendations. But really, after exposure, you are just going to be monitoring for symptoms. If you develop symptoms, obviously get tested. But if you are exposed, and you probably want to also test, they say 3 to 5 days after that exposure. That's important. If you can do a PCR test, that is probably going to be more reliable at that point. So those are the basics of quarantining after a known exposure.
Okay, Taylor's asking, if natural immunity only lasts about 90 days, how did older generations survive before vaccines?
I don't think natural immunity only lasts 90 days. The CDC just says that you are immune. Your immunity does continue to last. And I think what we are, that question also gets at other illnesses, and just understand that other illnesses are different than SARS-CoV-2 or even other common cough and cold coronaviruses, rhinoviruses. We know you can be reinfected with those somewhere down the line, 3, 6, 9 months, a year later. But for other things, for instance, like measles or smallpox, if you were around then, if you got that disease and you survived, then you would be immune for life. So different viral entities, different diseases are different and have different immune states long term. So I think hopefully that answers your question. Not every virus, not every infection is the same. Our immunity does act different. And a lot of what happens when you have these reinfections by these common cough and cold coronaviruses, by influenza, by rhinovirus, it is a lot of it based on immune evasion from those antibodies. But you still have some immune response there to help protect you, especially with those T cells, from those other more severe forms of the disease.
So Anne wants to know, she says her son emptied the dishwasher last night, which was very good of him, but then he tested positive for COVID this morning. Does she need to rewash those dishes that he touched and was in close contact with? We're past that?
Yeah, we are past that. Again, you always want to have good hygiene, good cleaning and disinfection processes, good hand hygiene as well, but you don't have to rewash those dishes. What we have seen truly is that fomite, or inanimate object exposure and infection, is extremely low, and it's really not considered a major issue. Certainly early on, we thought it was, and it was right to be cautious about that, but we certainly have new data, and so we are able to then modify our experiences and our guidance based on that new data. It's really more about being in those tight confined spaces and the respiratory droplets rather than those surfaces that you can pick it up. Now you can still get infected, but it is extremely low probability that would happen.
Going back to when we used to wipe down the groceries and things like that.
But that's why also, hand hygiene is so important, washing your hands frequently, trying to avoid putting your hands in your eyes, your nose, and your mouth as well.
All right, Joe Ellen has a question. Jamie, how do you get those people who smother you too much to back off? Just wanting to see if you can.
Sure.
Sometimes we don't feel loved enough, and then sometimes we can feel too loved and too supported. Tell us about that.
So sometimes it's knowing the intention of that other person. If their intention is good, they're really trying to help. Good, then you can kind of forgive them a little bit and take your anger down a notch. But speak up, and and I know that's way easier said than done. And I work with clients all the time on being more assertive and really saying, the formula is I feel when you and I want, right? So I feel smothered when you come over 6 days in a row for 12 hours a day, and I want you to come over, only on Tuesdays, something like that, right? But I know not everybody can receive that message. So even if you say it beautifully and perfectly, sometimes you get your head bit off, right? Or the people are sort of that wounded martyr that you've injured them and they'll never speak to you again. So or worse. So there's all sorts of caveats with being assertive. It's kind of like telling a kid to go stand up to the bully. Sometimes that's not really the right thing to do. But if you can, tell them. And if you're the one that is doing the smothering, ask, right? Say, I really want to be helpful. I'm worried I'm smothering you. I'm worried I'm doing it wrong or doing the wrong thing for you. Tell me, is this helpful? So it takes both parties kind of speaking up. And the more you know somebody, the more you know how to ask and what's going to fly and what's going to work with that individual.
Boy, that's a tough one.
Yes.
That's not easy for sure. All right. Thanks for that one. Okay. So Allison, Dr. Hawkinson, a couple more questions.
Yeah.
Do the COVID numbers that we publish daily include people admitted to the hospital for something other than COVID, but happen to have COVID and don't necessarily need treatment for COVID? Or do the numbers represent that all included in the count that they need COVID treatment? We do get a lot of questions about our numbers.
Yeah, absolutely. And we try to be transparent. When we have 100 or more patients in, it is difficult, but not all of those patients are in for COVID. The vast majority are in because of symptomatic COVID, but there are those people that come in and are tested incidentally and don't particularly have symptoms. But those patients even do add to our utilization of resources for that. But the majority of people here that we are counting, especially those in the ICU, are here because of symptomatic COVID, but definitely because we are testing everybody that comes into the hospital. There are people who are here for other reasons. For instance, people who get into car wrecks and are here for trauma and are tested, for people who come in for a heart attack, but then you could also say, well, did COVID bring that on? But to answer your question, there can be other reasons that they are here, but the majority of the people right now that are here counted in that acute active infections are here because of symptomatic disease for one reason or another. And I'd just like to also clarify on the quarantine question, there is a differential based on if you are vaccinated and up to date, meaning you've had your booster. If you have not, you should stay home and quarantine for 5 days and stay away from others and monitor for symptoms. If you have had your booster, you do not have to stay away, but in both instances, you should test at least 5 days after that final exposure. So hopefully that helps clarify.
We're going to get to some final thoughts here, but one of our viewers had posted something on our feed. I won't share their name, but I think this is something a lot of people can relate to. His wife of 38 years had passed away of a heart attack. She was young, 55 years old, and he feels guilty about being happy again and smiling and laughing. And how do you help people through that?
Yeah, that's a great question. It's a difficult situation. I think that guilt in general, it's good to identify if we're feeling guilty. And guilty means you've done something wrong. So if somebody has died and you're wanting to be happy, you haven't done anything wrong, right? There's nothing. It's not like if you rob a bank, you should probably feel guilty for robbing a bank. If you're grieving the loss of somebody you cared and loved about and wanting to live again and be happy, it makes total sense that somebody would feel guilty. But to try and challenge that and say that I shouldn't really feel guilty, even though I do. So then you get to say, all right, what do I want? Is it wrong to want to be happy? Is it wrong to smile again? Hopefully you're telling yourself, and those around you will tell you, no, of course, you need to live your life, and your spouse would want you to live a good life. So somehow trying to find a way to forgive yourself and move through that. And, we talk about sort of getting over things or over death or in a year you'll be fine. And it doesn't work that way. It's a process that you work through kind of continually. Some days more focus on that than other days. But I think everybody deserves to be happy and live their lives as well.
Gosh, this is some tough topics. And You're right. We all experience it so differently. So thanks for just helping us think and just be more mindful of how we navigate through these tough times in life. We appreciate it. Just some final thoughts. What would you like us to know? We really appreciate you being here today, by the way.
Thank you. I wish I had all the answers. I can ask the questions that, with that other person, we can generate some answers. And it's not easy. So, sometimes the experts are looked at as like, well, just do this and everything will be fine. So that's not the case in my field. So I think the thing is to stay curious, to ask questions, to strive to understand the other's point of view. And the antidote for anxiety, sometimes anxiety is trying to predict the future and control the future versus figuring out where do I have power and control, what can I do, and what can't I do. I can wear a mask. I can't stop COVID from happening. So put your energy where you have power and control and try and let the rest go if you can.
Jamie, thank you so much. Please come back.
Thank you.
Dr. Hawkinson, final thoughts today.
Yeah, I loved our insightful questions, the basic questions about quarantine and also vaccination. We will continue to endorse and promote vaccination as much as possible. I referenced this study yesterday in MMWR. A recent study did show that, those people who were up to date, so that is fully vaccinated and have had their booster, did have that reduced risk of going to the hospital still, even with Omicron. And so that is one other way that you can help. if you are not seeking medical attention in the emergency department or in a hospital bed, taking those resources for people who have other reasons to come to the hospital, gallbladder problems, heart attack, stroke, all those things that continue to happen even during the pandemic. So that is one other way that you can help your community and hopefully staying out of the hospital or avoiding ER visits as well. I think those things pretty much state why vaccination is good for you as an individual and your community as well. So.
Dr. Hawkinson, thanks so much. We'll see you back here tomorrow, and thank you all for being with us today. Don't forget, you can catch our shows anytime on our Facebook channel and our YouTube channel. Coming up tomorrow, 17 hospital chief medical officers from around the region will join Dr. Stites and bring us the very latest trends in the COVID surge. We will answer questions from the news media and also from you, our viewers. So everyone, please have a great Tuesday. We'll see you tomorrow here at 8 o'clock.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.